Hello, welcome back to the Physical Therapy San Pedro podcast. This is episode 60, and today we are answering your most top searched questions about physical therapy. I am your host, Dr. Janae Brown. I am the owner and founder of Physical Therapy San Pedro, and I am joined by my wonderful sports physical therapy team. To my right,
Dr. Bay.
And to my left,
Dr. Silverton.
Welcome, guys, and thank you guys for joining us. So October is Physical Therapy Month, and in honor of Physical Therapy Month, we are going to be celebrating all kinds of things in our center, but we thought it would be fun and exciting to come and share with you guys some of your most searched questions, like things that you guys are wanting to know about physical therapy or that you're typing in and searching. We are experts in the sports physical therapy field, and so we are excited to dive in and share with you guys all these great questions that you guys are interested in knowing about. So, you guys excited?
Very much.
Very excited? Woo! Get Dr. S excited, and it's fun. Okay, let's dive in. The first question I'm going to answer today is, what is the difference between sports physical therapy and regular physical therapy? So, here at Physical Therapy San Pedro, we are sports physical therapists. And you can go get physical therapy in a lot of different ways, right? You can go get physical therapy at an orthopedic center where they treat orthopedic injuries. You can get physical therapy for neurological issues. You can get it for pediatric issues. We treat sports physical therapy issues, which is typically just injuries that happen in sports. We're different because we're all strength coaches here. We all work with athletes and the active individual. We all have specialized training, and whether it be barbell training or higher level exercise training, plyometrics, return to sport activities. So our training is kind of what sets us apart. We don't learn these things in school. We had to do them post getting our doctorates in physical therapy. But we really try to focus on helping that active individual or the person returning back to sport get back. So that's really the difference. We're working on a little bit of performance, speed, agility, sport-specific movements, and we're just trying to get our athletes back feeling almost better than they did before they were injured. That's our goal. So that's the difference. Did I cover everything, you guys?
Sounds
Did I miss
good.
anything? Yeah, okay. Dr. Bay is going to answer our next question. Dr. Bay, what type of injuries do sports physical therapists treat?
We treat so many great ones. For example, our sprains and strains. So you might be thinking an ankle sprain or a hamstring strain, the ligament and muscle injuries. Next, we have tears, ligament and meniscus tears. So ACL, MCL, or meniscus tears at the knee are very common. Rotator cuff injuries and shoulder instability. Tendinitis at the knee, we're thinking probably patellar tendinitis, at the ankle, Achilles, and then there's tennis elbow, right? Stress fractures, super common in the feet, concussions and return to play management, and then overuse injuries. We're thinking here shin splints or runner's knee.
Awesome. There's probably a lot more, right, that we treat than that, but those are pretty much the things we see on
Very
a
common.
regular basis,
Yeah.
right? Do you agree?
Yep.
Yeah? Okay. Dr. S, coming to you. Do I need a referral to see a sports physical therapist?
In the state of California, no, you don't need a referral to start physical therapy. You can get your initial evaluation and see a physical therapist for up to 12 visits or 45 days, whichever one comes first. And before you need to go see the doctor and get a proper referral, there are some insurance limitations on that. Some are depending upon your insurance. Some do require the doctor's referral, though.
Awesome. Okay. Yeah, so we have direct access in California. It's not as direct as some other states. So we're lagging California. We need to get up to speed with all the other states that get to sort of bypass that 12 visit or 45-day requirement right now. So we're obviously we're fighting for it, but we're trying to lobby for it at the government level. But I think it'll change eventually. But what you not need to know is you can come see us straight away, right? Get injured, you can come see us as long as your insurance covers it. So we'll help you with that. Give us a call and we'll help guide you. Dr. Bay, how long does it take to recover from a sports injury?
Well, I like to think about this in two different phases. There's recovery, as in we're healing the injured tissues, and then there's our phase where we're guiding people back to their sport. Either they've been continuing in their sport with modifications, or we need to completely re-enter them into their sport. So the first time frame is for minor sprains and strains, and that's just a few weeks, very simple. Next is more moderate injuries, like a partial ligament tear, and we're thinking more like 6 to 12 weeks. There's going to be some return to sport guidance definitely there. Big ones are post-surgical recoveries from major surgeries like an ACL reconstruction. That is a big 6 to 12 month recovery typically. And lastly, all recoveries depend on the severity, the complications. Is it one body part? Is it multiple? And the patient's commitment to their treatment and rehabilitation. The more consistent you are, we always see much faster gains and return to sport.
Wonderful. Do you guys have anything else to add to that? Any thoughts? Show up, be consistent, work hard.
The harder you work before you're injured, that improves your healing time.
Yeah. And listen to what we say. Don't do things that you're not ready for, because then we get into trouble and we're going to have to go on a roller coaster versus a sort of linear line.
Yeah,
So,
keep
yeah.
those lines of communication open.
Yeah.
We can guide the fastest recovery.
Yeah, we want to help you. Okay, I'm answering the next one. The next question is, how often do I need to come to physical therapy? Well, it really depends, but let me answer some really straightforward answers. So if for an acute injury, post-surgery, it's typically 2 to 3 times a week for that. And that could be 3 to 4 weeks of time. For maintenance and prevention programs, it's usually 1 to 2 times a week. And then we tailor this frequency to your individual goals and sport. So I would say what I like to tell my patients is, if you're going to do the things that I need you to do at home, then I can see you a little less, right? And you're making good progress. So a patient that maybe doesn't have the time in their schedule to come 2 times a week or 3 times a week, but I think they need it and they want to come once, but they're going to be committed to their home program and committed to the things I'm asking them to do, and they're doing well with those things, that's fine. But if you don't want to do what we want you to do at home, because a lot of the work is done at home, we're with you only for an hour, 1 to 3 times a week, right? So if you're not going to do those things, I ask my patients to come in a little more frequently. So would you guys agree with that?
Mm-hmm.
Yes.
Yeah. Yeah. Do the work at home, and we don't have to see you that often, right? Yeah.
We can tell if you did the work.
We can track it in our app too. So we have ways, but we really just know because when we ask questions, we're kind of like investigators, we're a little bit of detectives. We know when you're lying and not telling the truth, but we want the best for you.
The body shows the evidence.
Ooh, that's a good one. It does.
You will be more flexible. You will be able to do harder things if you did the work at home.
Stronger, flexible, moving better, pain-free, less pain. Yeah. Okay, Dr. S, we're coming back to you. Can I keep training while doing physical therapy?
Absolutely. In fact, I encourage it. But most oftentimes there's going to be some modification depending upon what it is that's hurting. If the thing that hurts is limiting, then change the way you train so that way you can still move the thing and train the thing as best as possible. And that's more on the rehab-y side of things. And then we get creative as far as, okay, if you have a knee injury, okay, you got another leg and 2 other arms and the rest of your body is still trained and you still got your cardio to keep up. So we have to modify some things, but we got to keep that going. Otherwise, everything just atrophies and you have a bigger hole to climb out of after coming out of your rehab, just because everything else kind of went to the wayside on that.
Yep. Okay. Any other thoughts on that, Dr. Bay? The answers.
I like to keep everybody training when it's safe.
Yeah.
It's very important not to lose your skill sets that you've worked so hard for.
Yes, absolutely. But I will stop you if you're getting worse or you're not getting better. I think
Definitely.
the key is you gotta be getting better, or making little gains, otherwise if you're getting worse and you're not following our model of return to sport or keeping you training and we're making a bigger problem, then sometimes we'll tell you no. But our goal is to keep you training. We like keeping you trained. We want you to be in your sport and active. So we want you to keep doing things. And there's always workarounds, right? Maybe you can't do this thing, but you can do another thing or do a little bit of it, right? Yeah. Cool. Okay. Coming back to you, Dr. Bay. Will physical therapy help me come back stronger?
This is actually my favorite one because I often tell my youth athletes that coming to physical therapy is really a gift at their age. They get to learn so much about their bodies, how they work, what's actually required to be a strong athlete. We didn't learn this till we went to PT school, unless we had an exceptional team around us for our training. I didn't have that in my dance upbringing. So in physical therapy, you will correct your weaknesses, you will improve your body mechanics, you will build resilience, and our athletes and dancers often return stronger and more prepared than ever before.
Yep, that's right. Any other thoughts? Okay, I get a real fun question here. Does insurance cover sports physical therapy? So, being a business owner, I have to know a lot about insurance and how payments are made and how we collect the money. So, does insurance cover sports physical therapy? Yes, most insurance covers physical therapy and sports physical therapy. The problem with some insurances is that when they find out that you are pain-free and you can function at a normal level and do all your daily activities, sometimes they don't want to pay for physical therapy anymore. So sometimes we struggle to justify care beyond that with certain insurances. What should be happening is we are restoring you back to your prior level of function, and that is what the insurance should be paying for, and we try to justify that. But there are some that believe that that is beyond what's the normal requirement for day to day. So there might be, if your insurance says, no, we're not paying any further, it might be on you to continue paying out of pocket for the remainder of that return to sport phase and the performance phase and the getting stronger and back to sport phase. But we will fight for you to, be here as long as you can so that we can get you back to your activities and your sports. Did I cover everything on that?
I would just say here at PTSP, we've invested in ways to prove your medical necessity. For example, we have now force decks and dynamometers that can give us a better accuracy of how strong you actually are and showing the asymmetry side to side and showing if that's necessary, if your strength is adequate for your body.
So good.
And help us prove more.
Yeah.
That you're not ready, that you need more.
Yeah, so we can go back to your insurance and say, but these numbers say they're not ready, so.
And if that increases your predisposition to getting re-injured, when you go back to the things that you would normally do anyways, then we might be able to persuade the insurance to say that, hey, these guys are going to go back to that anyways, that you're going to get injured again, and that's more claims to you.
Yep, more cost to you because that's what they're going to have surgery, and that's thousands and thousands of dollars, and we are here trying to save you that money. So a little bit's about education to the insurance companies, education to you guys, but we're definitely fighting for you guys to get your full coverage that you're paying for. So yes, okay, Dr. S, coming back to you. How should I treat a sports injury immediately after it happens?
For the most part, don't freak out is the first thing I tell people. Unless you're bleeding, something sticking out of you, then yeah. When you have a strain, you feel something pop, and then I tell them, don't freak out. A lot of it comes from people not understanding that, this is how it should be. When should I go to the ER and things like that. If it's not an emergency situation, you just sprain your ankle. The old method was to do rest, ice compression, elevation. Most of that's been debunked by research now, as far as it doesn't really necessarily help with the rehab process on it. And if anything, it might delay progress on that too. So we go more for early mobilization as tolerated, assuming that we don't have any concerns of making things worse, like if you have a current fracture and you shouldn't be walking on that. So once we rule that out, then yeah, let's get it moving. Let's get things to calm down, manage the pain, the inflammation, the swelling, get the range of motion back, and we take it from there as we normally would with any sort of rehab.
Yep, good stuff. And what about ice versus heat for injury management? People want to know, ice or heat? What do I do after I sprain my ankle?
They die to know this.
Yeah. Typically, early on, ice tends to help out. Later on, heat tends to feel better. But once you're past that first early inflammation, early acute pain where it's like it's throbbing and it feels like to touch it feels really hot. Beyond that, like early on, that would be ice. After that, it comes down to player's choice. Whatever makes it feel good is what I tell people, and don't continue to do it just because you think it's gonna make it heal faster or anything like that. There's benefit. It's just mainly there to help you feel better, and there's benefit for pain management on that end of things. So if it makes you feel good, sure. But I tell people don't do it with the intent that it's gonna make you heal faster by putting that hot pack on a regular basis or ice pack on a regular basis.
Right. Absolutely. I always tell people like ice. If you sprain your ankle and something immediately, ice is good for pain. And if you're gonna pop a pill, put an ice pack on it. It'll help probably with pain. But technically, right, like you said, ice and heat, it's about how you feel. It calms down your nervous system. So if one of them makes you feel good, that's cool. It's not probably really changing much other than calming down how you feel, which is good because we all, when we have pain or we're anxious or nervous or we're not feeling good, we want to feel good. And our nervous system kind of dictates how we feel. So if you feel good with ice, use it. If you go with heat, use it. But if you hate ice, don't put ice on yourself because you're going to feel worse. You're just going to be more
that
intense.
Freak out he talked about.
Yeah. You're just going to feel worse. Yeah. Okay. There you got it. You got 2 answers on that. Okay. Next question. Yes. Can Dr. Bay, I'm coming back to you, right? Or is that mine?
This is yours.
Oh, this is mine.
You don't
See?
have to do it.
I can, yeah. I was skipping questions. Here we go. Number 10 on here. Okay. Can physical therapy replace surgery for certain injuries or certain sports injuries? So in many cases, I might get in trouble for this, but in many cases, yes, physical therapy can replace surgery. And our goal as physical therapists is to keep you from having surgery, to keep you from having to do something that you may not have to do. There are many injuries where surgery is required. If you break your ankle and it's a compound fracture, you have all these pieces, you have to go in there and realign and set it so that you can walk again, right? But if you sprain your ankle really bad, or even if you have mild tearing in the ligament, it can heal, right? We know that because research has proved that, right? We know that meniscus tears can heal with rehab. We know that MCL tears can heal with rehab. We've even seen now ACL tears, full tears that are healing with rehab. So we want to save you from surgery because once you open someone up, you expose them to more arthritis down the line in their life. You shorten the time they can get back to the things they were doing before. So we want to help you by saving that. So yes, PT can replace surgery in very many instances. So do you guys have any other thoughts on that?
Sometimes it comes down to finding the smoothest path back to normal function. And I understand that people can get kind of anxious as far as like, well, this is wrong with me. This needs to be taken out in order to be fixed. And oftentimes it's not necessarily a structural sort of thing. We have a lot of fancy machinery and imagery to see what's inside our bodies now. And research has been showing that with the short period of time that we've had MRIs and CTs, and that we can point at all these things that are quote unquote wrong with our bodies, and that we're figuring out that it's more just, these are just wrinkles inside our bodies, natural things that happen and progress with age, and doesn't necessarily mean that that's the source of pain. And that we can, so long as we go through the normal rehab path and healing and strengthening through those areas and getting back towards normal function, that actually has similar outcomes as surgery does and the thing I'm thinking of is like back surgeries and things like that too. And sometimes it comes down to more self-imposed healing time. There's good research out there as far as, hey, was it really the surgery that helped you out, or the fact that you had to be down for 3 months out of surgery that you just had to forced to take out of work? Or if you compare that to someone that just took 3 months off of work and just did the rehab and just gradually got back and doing things, was that any better? And yeah, they're seeing that they've done sham surgeries where they'll open someone up in their knees, poke the holes in them, not do any particular cleanup inside their knee, And so half the people got the sham surgery, half the people got the actual surgery, similar time frames for physical therapy afterwards, and you get similar outcomes also. So yeah.
Yeah, we're thinking about, I'm thinking about a patient we have right now that I'm like, stop working for 2 or 3 months, please, because it's the thing. If you have surgery, you have to stop working for 2 or 3 months to recover. And oftentimes we see that just stop in not doing what the thing that really irritates you over and over and over again, like sitting for prolonged periods or doing a certain job that is irritable. That is the thing that you need to heal. You need just to stop, right? And I've had cases with patients where I was like, you know what? I support the surgery because you're not going to stop, right? And I know that when you have surgery, you will stop, so you'll get better. So it's hard. These are tough things, but we definitely, and we know it's hard. You have to work. You have to provide for your family sometimes. Sometimes your surgeon tells you to do surgery and you want to do what they say. But just know physical therapy is a first line of treatment. And I believe any good surgeon would send a patient to PT first to see if there's a possibility to avoid surgery in certain situations. So, yeah.
I'll throw it out there. There's in California we have paid disability leave and family medical leave acts as well that some people might be able to take advantage of in order to take that time off, because it is a lot to ask a patient to just hey, stop working. Well, yeah, it's easy to say that, but like what's the actual process look like and what are the consequences that they may incur on that is an understandable conversation to have with people.
Yeah, agreed. Any thoughts?
No, I agree with everything you guys said.
Yeah. Okay.
Sometimes that time off is super necessary.
Yeah. Okay, Dr. Bay, coming back to you now, right? Will physical therapy hurt, Dr. Bay?
That's complicated. Still, we're trying to debunk the no pain, no gain myth every day. So the reality is in your journey through rehabilitation, we're going to ask you to do things you're not very good at. We're going to ask you to move in ways you're not used to moving or engage muscles that you haven't felt in a long time, and that is uncomfortable. We call that discomfort, right? Stretching discomfort, strengthening discomfort, but that is not injury pain. So physical therapy should not cause injury pain. It should be comfortable, but uncomfortable. So our pain should be tolerable and closely monitored. Continue to always let your therapist know what you're feeling with things, and they can help you make guided decisions about if this is safe in the process or not. You should not just work through sensations without communication, because we always want you to come out feeling better and not worse. And that is our goal. Your home program should make you feel better. Every treatment, you should come out feeling better.
Yeah, good answer. This is a tricky one. And I think as a physical therapist, like even us, like we're going to try, you might be doing really well with something, and then we might try something new, and then that thing doesn't feel good. And you go home and you're like, oh, I'm in a little more pain. First of all, don't be scared. Don't be worried, right? Your body is healing in a healing process. So usually when you're doing all the things we're doing, you recover so much quicker than you would have before if you felt something weird. But it's not re-injuring the injury you have oftentimes, but you're feeling new things. And we try something. Sometimes we go backwards and we go back forwards. We're all just self-discovering sometimes what you can handle. Also, you do things that we tell you not to do. And we don't always know what you're doing all day, right? You could be doing something that is aggravating yourself that day, and we give you some exercises to do and it's too much. So the key is listen to your body. If something doesn't feel good, even that we give you, don't do it. But it is a process. It is it takes time to get to the end of the race, and it will have its ups and downs, but ultimately, if you're committed to the process, you'll feel good. And our goal is to send you home feeling good after your session. So your session should make you feel better. Sometimes we don't get it right. And I've had patients at the end of the session be like, we tried something, like, oh, that hurt. And I'm like, okay, well, let me know if it persists. We're just trying to get you better and stronger. So we're sometimes shooting in the dark and seeing if you're ready for something based on, how your injury is progressing. Yeah. Any thoughts on that, Dr. S?
Yeah, we just take our best guesses on it. And it's complicated in that it depends upon the person as far as how they respond to pain, not just physically, emotionally, historically as well. Their how much training they've had in the past. People that are used to exercise, or if I'm explaining that, yes, that's called muscle soreness because you worked that out. And so I'm always trying to dial in people as far as like, okay, how hard can we push? Do we push a little further? Do we have to dial it back? And trying to get that mixture right. And everyone's going to be a little different. It's always guided by, okay, mild, for the most part, mild discomfort that goes away within a few minutes. And if you get that post session soreness, as long as it's mild and goes away within like a day or so, it doesn't get in the way of day-to-day activities, and okay, that's where we're at. That's fine. I wouldn't want to ever get to the point where it's like, yeah, debilitating or anything like that. Then that's a little excessive. Then we definitely know that we got to dial back on some things.
Yeah. I was in the gym the other day, and I heard a person talking to their trainer, and they were saying that they go to PT with a physical therapist, and they were like, every time I go, they make me do this thing on the Bosu that really hurts my knee. And I'm like, so somehow I got involved in that conversation by them asking me a question. And I said, well, do you tell like your PT that it hurts? Or, well, I tell the assistant every time, but they just keep making me do it. That's problematic. Like, you shouldn't have, like, if you're voicing that, we try to be really good at here about asking, is it bothering you? Is this increasing your pain or your irritability? Because if that's probably the wrong thing to do. And your team has to be trained to do that too, like how to ask those questions. So those things shouldn't hurt, right? We're talking about maybe you feel really great all through your session and you go home and you have some increased pain. That sometimes we can't control. But in your session, exercise, you should feel pretty good doing it. Would you guys agree? Yeah. So that is what you want to be careful of. If you're going to a PT place, you might be at the wrong place if they're doing that with you, because you can't get better when you're really hurting. Your body is like in a fight stage. So you got to feel good to get better. All right. Dr. S, coming back to you. When can I get back to my sport or activity?
Not a complicated question, but typically guided by where the tissues are at. So if we're talking after a fracture, there's normal time frames that the tissues heal at. So the bones have to grow back together, and they have to make sure that it's well aligned, and then we start challenging a little bit gradually over time, so that way we build the density. That also has to just be, like we talked about before, just because it's healed on the inside doesn't mean that it doesn't hurt. Things can still hurt. So in which case, we're not going to forge forward just because the timeline says you can. We got to take all that into consideration. Other things as far as return to sport or activities, is that you have to figure out if you're strong enough to do the thing that you want to be able to do, and can you support yourself in order to do that to whatever volume that you want to be able to do it at. So it's a guided process, and we're just guides in your journey back to wherever you want to be, just because we don't know exactly, but we know the general steps and general ideas as far as like, okay, let's try just doing that for 10 minutes at a time, once a week, and let's see how that goes. Let's get a few of those sessions in of pickleball or whatever the case might be, where you just play one game that's less than 10 minutes and see how that feels to start off with, and we'll just gradually increase from there if we need to dial it back. It's on a per person basis on that, and we just help you guide that. We just help guide you down that path to see how much things can tolerate at that point in time. There are some things that, as far as normal healing times for tissues, we know that, and then everything else comes down to whether we need to test it to see if it's ready for that type of strain yet, or we just need to fool around and find out.
Yeah. Good stuff. Any other thoughts?
No, that covers it.
Awesome. Okay, Dr. Bay, does stretching prevent injuries?
It depends. So, I like to think of people in two types of bodies. So we have our strong people and we have our flexible people. So our strong people, stiff people, can definitely benefit from regular flexibility. But alone, this is not enough to prevent injuries. But those that are built stronger and stiffer need to do their regular flexibility. I like to educate my patients that everyone needs to be working on strength, flexibility, mobility, and cardiovascular training. So if you're skipping any of those, you are at risk. But we do know, for example, if someone's hamstring is getting tight, their straight leg raise is now only halfway up, they are at that borderline where they could easily pull their hamstring or their back, right? So stretching is very good for us, but alone it is not enough.
I think that's good. Do you have any thoughts?
No, if you don't have the flexibility to do the thing you want to be able to do, then yeah, you're gonna make up for it somewhere else.
Yep. So, yep. I think that's it. I think you guys answered it. Okay, I'm going to answer the last question here. The last question is, are certain injuries more common in women versus men? I'll say that again. Are certain injuries more common in women versus men? So what we know right now, for example, so the answer is yes. And what we know right now is, for example, ACL injuries are more common in women than in men. We think this is related to hormones and how women's hormonal processes are, and with menstruation and just our bodies in general. But we're still doing research to prove those things. I think we would probably say that we see certain injuries more in women than men based on sport. I would say, I don't know if you guys have any thoughts on that, but like, are you seeing men get injured a certain way differently than you see a lot of women get injured in your practice?
Well, I think maybe like medial elbow injuries for pitchers, right? Baseball versus softball have different mechanics for their pitching.
Yep. It's a good one. You have one that you see?
Nothing off the top of my head right now. ACL is the easiest one.
Yeah.
That's research supported on that.
Yeah. I would say like sport driven, like weightlifters, strongmen, back injury. Like you see those are men, typically men's sports, back injuries we see very common in those sports, lifting heavy weights and moving stuff. But yeah, I think it's more sport dependent too. But men play certain sports, women play other sports, or involved in other things. So that might be a little bit of a differentiation as well. But we do know right now that women tend to have ACL injuries more commonly than men. So that's one that we see. Yeah. So we're a little different. We're in that way.
We're definitely built different.
We're definitely built different. Definitely mentally and emotionally too. But we won't talk about that in this podcast, because we don't want to hurt Dr. Silverton's feelings in conversation about this.
Already there.
He's married though, so he knows. Okay, well, that's it. We've answered your guys' most common and top searched questions about physical therapy and injury. We hope you guys enjoyed that for National Physical Therapy Month in October. And we just want to share with you guys, educate you about all the great things that physical therapists do and things that you guys want to know about. So we hope that helped and that you guys enjoyed this discussion together. If you're struggling with an injury, don't wait. Get it checked out at Physical Therapy San Pedro. We can treat you in the clinic here in San Pedro, which is in Los Angeles, or we can see you via telehealth over a Zoom call or a Google Meet call across the world. So we want to help you. We work with athletes across the world, and you could be that person getting some help right now. So don't wait, okay? Click the notes in the episode notes and show notes, and you'll get to see all this great information in there and information about our clinic, our website, physicaltherapysanpedro.com. We have 59 other episodes on YouTube and on our podcast that you can check out and watch and listen to, or you can go to our website and read our blogs and read it there. However you want to read, listen, view, watch, we got a ton of great information for you that you guys can check out. And I think that's it. Do you guys have any other final thoughts? All right. We'll see you guys next time. Bye.